Politics is so intertwined now with your money. White House Press Secretary Sean Spicer, he's going to be speaking any minute now. We do expect him to address a number of topics today, including the Republican health care bill, which is showing some new signs of hope today after Representative Fred Upton introduced an amendment that will help people with pre-existing conditions. That's been the big sticking point in the GOP. Also, we expect Spicer to answer questions on the spending bill, which the House is going to vote on later today. As we wait, though, for Mr. Spicer, I want to bring in former Illinois Congressman and national syndicated radio host Joe Walsh and former chairman of the D.C. Democratic Party, Scott Bolden. And it's great to see you both. And
good afternoon.
You know, Jim, I got to start with you on this. I mean, this pre-existing condition fight has really become a sticking point for the moderates. But Upton seems to be sort of bringing everyone together. I mean, 22 Republicans can kill this, or they can give it their blessing. Where do you think we sit right now? State of play. Joe, I'm sorry. Joe.
Oh, I'm sorry. You know what? I think the pressure to pass something is so great that they're probably going to do it, and they're probably going to vote on it tomorrow. You had a Republican senator, I think, yesterday say it's more important to pass it than what's in it. Now, that's something Pelosi said about 7 or 8 years ago. But I think that's where the Republicans are at as well. Trump has laid down the law. They got to pass something. It's a shame because I think passing this bill is really going to hurt Republicans, but I think the political pressure is just too great for these guys.
Okay. Scott, do you agree with that, the political pressure? I mean, we expect the Democrats to say no, but they're loving the infighting that we continue to see among the Republicans. I think the Republicans understand that, and I also think that they're under a lot of pressure. They've gotten several phone calls from the president today, we understand.
Yeah, but they've gotten phone calls from each other as well. I mean, this health care bill, whatever machination it is, it's been like Rubik's Cube, if you will, where you satisfy the Freedom Caucus and then you dissatisfy the Tuesday group. And so I haven't seen this bill, but it depends on where this $8 billion is going to come from over what period of time and whether you can get the Republicans all to play nice in the sandbox and to pass it. The outreach to the Democrats is still lacking, and when it gets to the Senate, or if it gets to the Senate, you're right. It doesn't really matter to the House Republicans. They're so embarrassed and so dysfunctional that just getting something out, they can sell it during the midterms. That's really empty politics, if you ask me. And they ought to be better with that.
But Joe, isn't something better than nothing at this point, considering they've come together on pre-existing conditions? It looks like, we think, but we could be wrong. And that also, but also you've got to talk about tax reform. You've got the budget vote today. I mean, there's other things that they've got to focus on besides health care, Joe.
This is, no, to answer your question briefly, no, I think something is not better than nothing. I mean, think about it. This is a bill that will not repeal Obamacare, and it really doesn't protect pre-existing conditions. It's kind of this messy thing right in the middle that's not going to please either side.
And I wish I could tell you both that we knew where we stood on pre-existing conditions, but it's murky still. Joe, Scott, we're